so we can go ahead and jump in. Thank you all for joining today. We have a great session planned for you. We'll be talking about our 2026 Reverification season. We have Tom Bavin, who's our VP of seeQer Operations on the line, as well as PJ Flanagan, who's our Director of Patient Support Services. So just to kick us off here, my name is Lauren. I'm on the CareViso marketing team. And I'll kick us off with a quick introduction to CareViso, so talking a bit about who we are and what we do, and our platform seeQer. Then we'll pass the mic over to Tom, who will talk a bit about how seeQer improved Reverification season and share some of our stats from the most recent season. And then lastly, we'll round out with PJ, who will talk a bit about how seeQer scaled, some new features we have, and also what's coming in our product pipeline. We will have time for questions in our live Q&A. If you have any questions at any point throughout the webinar, you can use the Q&A function, and we'll just be answering those at that later section. We will round out with a closing, and we'll provide some contact information if you'd like to reach out to us after today's webinar with any questions. So starting us out with what we do, we've created a platform called seeQer, and it provides patients with access to care faster by delivering cost estimates, administrative requirements, and approvals all in real time. We work with a variety of different healthcare organizations across the healthcare ecosystem, such as patient access services, pharmaceutical manufacturers, payers, physicians, and laboratory diagnostics. So we really began with the laboratory diagnostics organizations with a focus on diagnostic testing patient access. So we were founded in 2017, and that's when payers began requiring physicians to perform prior authorizations for molecular diagnostic testing. And we then started processing prior authorizations on behalf of the physicians and started partnering with laboratories. Today, like I mentioned, we're working with all sorts of different healthcare organizations across the landscape. And our solution encompasses all specialties and all therapeutic areas. We operate heavily in oncology, OBGYN, ophthalmology, dermatology, and rheumatology. But like I said, we operate all over healthcare in all sorts of specialties and therapeutic areas. We perform over 1 million prior authorizations in a year in the lab diagnostic space, and over 2 million seeQer electronic medical benefit verification transactions per year as well. As you'll see later in today's session, where PJ will be talking a little bit about this, but we are constantly optimizing our platform, adding new features, and listening to customer feedback in areas in which we can expand on. So talking a bit about seeQer, we call it our single platform for patient access. We created seeQer to simplify the process for patient access and reimbursement all in real time. We have a number of proprietary databases that can tell you the network status of a provider or facility, patient benefits, patient cost responsibility, PA requirements, meaning if a prior authorization is required or not for a specific procedure, test, or drug, health plan coverage, step therapy, and coordination of benefits. We have this process broken out into 3 different pieces here that you'll see on the right side of our slides. The first being benefits. So we have all of our clients send all their cases to us, and that's where seeQer determines the member health insurance benefits. seeQer then runs through our proprietary databases and determines the cost and coverage of a specific drug, product, procedure, or test. And lastly, we have the prior authorization piece. So currently seeQer flags PA requirements, so if a prior authorization is required or not. And we have a new feature coming March 6th that PJ will also expand on, where seeQer can tell if a prior authorization is already on file, which can help reduce duplicate work and give teams more insight into the prior authorization process. So with that, we can pass the mic over to Tom Bavin to talk a bit about our Reverification season performance.
Perfect. Thanks, Lauren. So I'm going to go through just a couple of slides here, first on key numbers, and then kind of talk about some data points and then how we perform from a specialty standpoint. So when we look at kind of overall key numbers, we performed for 51 distinct clients, just under 1,700 unique products across CareViso for this Reverification season. With those products and clients, we had an 87% benefit pullback rate. What that means is 87% of the time we're able to provide benefits or we're able to determine if a patient, say, is coverage confirmed inactive. So in this 87%, the majority of the cases you have what we call a BI result successful. So that means we're able to locate the patient, get the patient's eligibility information, and then pull all of that information back from a benefit standpoint. So deductible, out of pocket, co-insurance, copay, etc. Within that as well, we're also able to determine on a smaller portion of patients if they have what's called no out-of-network benefits. So if we determine based on the provider's network status that that provider is out of network for that patient's health plan, when you pull the benefits, instead of us generating a BI result successful piece of information, we'll generate a no out-of-network benefits piece of information, just saying, yep, we can find the patient, here is the patient's benefits, but because they're out of network, we are going to show that, hey, there's a no out-of-network message in here. The last piece that goes into here that we kind of put into our pullback rate is patient coverage confirmed inactive. So what that means is we can go out to that insurance company with the same information that's been provided to us, and we're able to find the patient. So I can find patient first name, last name, member ID, and date of birth as a match in that payer's database. However, at this point in time, their coverage is inactive. And that's really important because then you know, hey, from that specific avenue, from a patient perspective, I need to go back to the patient for updated insurance information. The insurance information that I may have is old. When we move on to how long did this actually take on a case by case perspective, it took around 20 seconds from a turnaround time. And so that's from when the case gets created in Keviso to we're able to generate a result. And that's just not us going out to the payer and then pulling back information and then generating an estimate. It's going out to the payer. We're then pulling network status. We're pulling pricing. We're going through our various databases that we have on the Keviso side of things. So PA requirements, step therapy, kind of all those data points that kind of sit on the back end of Keviso, all in that kind of 20-second estimate to then provide, hey, here's the patient's active coverage information, here are their benefits information, and then here is all the information that applies to their benefits as well. So PA requirements, coverage, step therapy, etc. When we look at our kind of season as a whole, we had a 185% increase in reverification season compared to the previous year, and we had a one-day high of just under 11,000 patients that we saw come through Keviso in a specific time frame there. Across January and February, we processed over 330,000 cases across kind of the whole reverifications timeline. And in that period, we process cases in a variety of different means. So currently on Keviso, there's three main ways to get cases to us, and we saw all three across kind of our reverification season. We saw API cases, we saw CSV file cases, and then we saw portal cases. API, which is how we have with most of our clients, is a robust technical integration that's between the client system and then Keviso, where they're kind of firing cases off in real time. So a patient comes over at 12:07, then a patient comes over at 12:09. As soon as it hits the client system, it then comes over to Keviso, and then we return the results back. The second most common that we saw was for CSV files, and especially from a reverification season standpoint, we saw quite a few CSV files at the very start of January, where, hey, we want to re-verify a bunch of patients all at once to make sure that we know how do we prioritize, how do we return this data back to clients in a quick fashion here. On the CSV file front, you'll be given a file that's sent over like an SFTP, so a secure file transfer protocol. We then load that into our system and then return the results back in a CSV file as well. And those cases are taking 20 seconds as well. Instead of us returning kind of one case at a time, we're returning it in batches. So the batch we get from you as a client, we then return back as a batch towards you as well. And then the last method that we had and we saw from a process perspective was portal cases. So a couple of our clients, they also type directly into the Keviso portal. So they're typing first name, last name, all of the patient information, and then they're clicking kind of submit in the individual Keviso system. We then return the information back the same way through the portal, all within that kind of 20-second time frame here as well. And so over that 330, we saw three different methods of transmission in Keviso. And then just wanted to touch on as well how we operate across kind of numerous specialties and then how our data points play into this here as well. So across this time frame, we saw 460 different specialties ordered through Keviso. Well, kind of the biggest specialties we saw were being neurology and then ophthalmology on the Keviso side. This is really important because on the specialty and then the provider, we're looking at the provider's network status, right? And that provider's network status is going to drive everything. It's going to drive everything from a benefit standpoint, and then it's going to drive everything from a peer requirements and then step therapy perspective as well. And so us seeing all these specialties allowed us to pull those correct network statuses and then provide accurate information from a peer requirements benefit standpoint because we're pulling in the specialty there. In addition, kind of aligned with our specialties here is the most common products we saw during this time frame. Time frame were macular degeneration, and then infusion related products would kind of go with the specialties up top as well. In addition, and when we talk about specialties and we talk about data points that we're able to provide during the time frame of reverification season and then through the last couple of months of last year, we added 10 new data points across CareViso, including kind of coordination of benefits and then step therapy. This all goes into kind of our message and why we saw such an increase this year is our goal is to kind of remove time on the phone, remove kind of having to make those manual interventions, and then using CareViso allows you to get most of the data over the API, most of the data over the CSV file, and then it saves time and still allows your team to kind of go about their day and then move forward with it.
Thank you, Tom. So with that, we'll kick it over to PJ, who will talk a bit about how seeQer scaled this season and what we have ahead for our product.
Great. Thanks, Lauren. Thank you, everybody, for joining. We really appreciate it, and we're excited to share this information with you. What things changed from perhaps AR season of 25 to AR season of 26 from a CareViso standpoint? And, why and how were we able to achieve the numbers that we did that Tom just reviewed? So there are a couple of key thoughts that go behind that. The first is we work closely with existing clients and specifically with program managers and directors to help, number one, increase the accuracy rate of the seeker result by working closely with their teams to address common errors, whether it was a common error on their side, whether it was something perhaps that we needed to revise or update on our side. Things like making sure that what you call a payer on your end is what we call a payer on our end. So we wanted to make sure that things like that were in place and aligned. And because we had all of 2025 to make sure that these things were in place, it ultimately allowed the program managers from existing clients to feel more comfortable utilizing the solution, sending the cases, and knowing that they are going to get reliable, accurate results. The second is, again, with the existing programs that we work with, is we wanted to make sure that any of those that were going to be using our portal, our user interface, were extensively trained so that if once they submitted it and the information that they were required to enter into the portal was clear to them and where they go on the portal to get the specific results was also very clear. And we saw a significant uptick of portal usage during this year's AR season. And then the final piece is just making sure that the PMs and the agents themselves feel confident in the seeker results that we deliver. And we do that in a number of different ways. First of all, we have several case studies that show how we compare our results compared to the actual claims that are submitted, which is basically the gold standard for accuracy when it comes to a medical EBV. We partner on the laboratory side with a number of physician practices that make their claims available. And because we can utilize those claims to measure our results against, we can determine, in fact, how genuinely successful and accurate the solution is. And over and over and over again, we see that it's 90 to 95% accurate to the claims themselves. Additionally, as a part of our protocol with working with clients, we do provide daily, weekly, monthly, quarterly reporting to them on areas where their program is being successful using seeker, areas of opportunity for improvement, whether it's on their end or our end. We work collaboratively to make sure that those errors are addressed. And because we did that, the agents felt more and more comfortable utilizing the solution versus perhaps making the phone call or anything that any other resource that they may have used in the past. Now, the second part is something that Tom has already touched upon. So we, versus the 25 AR, we've added 10 critical data points to the result for seeker. A couple of those that we found to be very critical are the coordination of benefits features that we've added and the step therapy benefits. The fact that we've added this many new data points now allowed programs that last year perhaps couldn't have used us or didn't see necessarily the benefit. A lot of those programs now have decided, hey, we are getting the information from this automated solution this year, and felt comfortable sending the cases our way again versus either their current resource or a phone call. And then the third is, and Tom touched on this, again, we have three means of communication with clients. So the API, which of course is the preferred method, this is the robust integration into the client system that delivers the information instantaneously. We are in that particular position with some clients, and we are working towards building towards that with others. Then, of course, Tom touched on the fact that many of our clients utilize the batch or the CSV process to submit large numbers of data and large number of patients at one time. And then finally, the user interface, the portal itself, where the agents would simply enter manually the information. And typically, it takes about 20 to 25 seconds, give or take, to deliver the results back from the seeQer solution. So, what I'd like to get into now is kind of where do we stand moving forward as far as enhancing the seeQer solution and some of the other services that we provide. So, I'd like to take a moment or two to discuss our kind of short-term roadmap for you and the things that we have lined up for launch ultimately over the next few quarters. So, the first of which is a solution that we are calling PA on File, and this is going to launch. Actually, it's going to be deployed this upcoming Friday. It's going to be officially launched live the following Monday. And on each of these, I'm going to delve into kind of get into depth as to what is a part of them. So I'm just going to kind of quickly touch on the topics now, and then we'll delve a little deeper into each of them. The second is we have newly announced and will be ultimately launching pharmacy benefits in the second quarter. The launch date for that right now is sometime mid-April. We also will be launching in the second quarter a solution that we call PA Submit Right. And really what this is where do you send the PA? So the portal, the fax number, the phone number, and even a pre-filled out document for you. And then really exciting news, and this one is still kind of in the process of being created. Come Q4, we will be actually fully submitting medical PAs. So this is something that is brand new for an organization like us, and there will be a lot more detail to follow over the next few months. So let's take a deeper dive into the PA on File solution. So again, really what this is currently we let you know in the seeQer solution, is a PA required or is it not required? Well, this will take it a step further. What we're going to let you know is there a PA on file? And if there is, what is the status of that specific PA? So we're going to provide data points like the date of the status update, a reference number, an authorization number, effective dates and effective date ranges. And ultimately, if there is a denial, what is the denial reason and codes? Now, the initial launch of this particular solution will be available utilizing 70 payers. And if anybody's interested in getting that information, the specific payer list, please feel free afterwards to reach out to me and I'd be happy to provide that information for you. The intent, of course, is for us to continue to grow this particular list to become more inclusive, but we do have many of the majors that are a part of this particular list of 70. Now, the next solution that we talked about, of course, is our ability to now, in addition to providing medical benefits, if you want to, move to the next, we will now be submitting pharmacy benefits, basically, and delivering pharmacy benefits. And we have a relationship where we can provide information from 4 of the major PBMs, so Optum, CVS, Express Scripts, and Humana. And we feel that this covers in the range of 80 to 85% of covered lives. Now, the current offering and the initial offering it will only be for drugs that have dual benefits, so both pharmacy and medical benefits. The intent is down the road, we will be able to provide this information on those individual products. And again, this is a mid-April go live at this point. So we're excited about this. So ultimately, if there's any additional questions that you might have about this or any of the other features, please feel free to reach out or ask some questions at the end of the call, and we'll do our best to address that. And then the final solution that we're adding to our platform is this idea of where the PA is submitted. And we call this PA Submit Right. So we're going to provide for you information on things like the portal name, the phone number, the fax number, and even the PDF of the fax form that will be filled out with information that we've ultimately obtained. Now, some fields might ultimately need to be completed by the HCP, but some will be pre-populated by us. Now, as far as coverage with payers is concerned, this will be a much larger list. You ultimately will be looking at anywhere between 92 to 95% of all covered lives. And again, we're looking for the PA submit rate launch date to be sometime in mid-May. So again, this is a Q2 offering for you.
All right. Thank you so much, PJ and Tom. We now have some time to do some live questions. Like I mentioned at the beginning of this call, feel free to submit your questions using a Q&A feature of the webinar, and we can answer them today. And I'll give everyone a second just to type in any questions. Give me 1 second. I'm just going to stop sharing for a moment to be able to view the Q&A. All right. We did get one come in. Were there any volume trends or specialty patterns that surprised you this year?
Sure, I can take this one. So coming into it, I think we were expecting kind of a lot of volume at the start of the year and it kind of tailing off throughout January and February. I think what we saw that surprised us is we saw kind of a bit of everything. So we had a couple of kind of clients that started where we got files the 2nd of January, we got kind of big batches of patients and cases to run for verification kind of immediately. So on the 2nd of January, which I believe was a Friday, and then the 5th of January, which was a Monday, we see a lot of work come through initially. And then kind of what surprised me was some programs were, hey, and products we're going to do the 2nd and the 5th. Others were much more measured. And so we had about half the work was kind of in that initial kind of time period. And then for other products, we kind of saw files on a weekly basis or cases over the API on a weekly basis, mainly through the latter half of January, which definitely was kind of surprising based on feedback that we'd originally had. And then what we also saw is as verification season kind of winded down, so you look at the end of January and the end of February, we got quite a few requests from a kind of catch-up file perspective, where a couple of clients would come to us and say, hey, we're falling a bit behind in terms of some of the work that we have. Can we kind of send a file to Kevis? And so quite a bit of that at the end of January and then start of February there as well.
Thanks, Tom. See if we have anything else. Okay, we did get one. What makes seeQer different from traditional reverification workflows?
Yeah, I can address that. I think so. When you kind of consider your traditional workflows for re-verification season, certainly I think that the first is going to be the manual phone calls that are made to the payers. Additionally, there are a few other vendors out there that try to provide a comprehensive medical EBB like we do. So there are some relationships, perhaps with IVR or botted phone calls as well to deliver the medical EBVs. What differentiates us, I think, is really kind of on a number of different levels. First of which, ours is the only one true, genuine, real-time delivery of a medical EBV result. So again, you're looking at a matter of 20, 30 seconds to see the result from when it's ultimately submitted. We also provide for you the actual contracted rates. So we have taken the time to do the work to obtain the actual contracted rates from the payers' websites. And when we deliver that, we obviously marry that information with the NPI and the network status, and then look at the J code, CPT code, and deliver the actual contracted rates rather than a Medicare fee schedule or an AI estimate. So again, that is one of the differentiators that we have as well. And then ultimately, I think finally speaking, is the number of data points that we're able to deliver. So as you saw, we were able to grow it over the course of last year to 50, or excuse me, by 10 data points, now to 50 data points. We have found and have heard back from our clients that the comprehensive nature of the results that we have delivered has allowed them to save the time that they spend on the phone to the payers from upwards of an hour down to 20 minutes, 15 minutes. So a significant savings of on-hold time with the payers. And the important thing to note is that we continue to add data points in an effort to reduce that time down to as close to zero as possible. Many of the enhancements that we've added to the solution have come as feedback from the clients, utilizing the call scripts that they have, and the verification of benefit summary sheets that they have. And we identify what we aren't currently providing and then take steps to go ahead and add those to the results. That's how we were able to and how we identified the PA on file, the pharmacy benefits, and the submit right solution to be added immediately. So I think all of those played a factor.
Thanks, PJ. Any other questions? Feel free to put them in the Q&A. We do have one more, it looks like. How does seeQer integrate into existing patient access workflows without disrupting operations?
Do you want me to take that, Tom, or you?
Yeah, why don't you take it and I can add on as well.
Yeah, so the first, I think that the best way to attack that or to look at that is number one. Again, we have three means of communication, and so if yours is a scenario where you want the API set up, that is the preferred method, and we do have APIs set up into the customers. Many times it's their CRM or whatever resource they ultimately are utilizing. So that's an easy build for us. And I think that ultimately that's the most seamless way of sending and receiving information regarding the medical EBVs. But also to make sure that we can accommodate those folks that don't have the API, we do offer the opportunity for the batch files for large numbers to be delivered and received within a matter of 1 or 2 or 3 hours. Obviously, we love to know the SLAs that you might know or might have from your programs to make sure that we can meet those SLAs. And for the vast majority of times, the CSV can still do that, given that the SLAs for many of the programs are 2, 3, and 4 hours. And then finally, if you're in a swivel chair scenario and you need to utilize the user interface, we make that available for you as well. So any way that you need to access it from within your current confines and with your current workflow, we can accommodate.
Yeah, and I think just to add as well, like when we integrate with clients, we're very upfront with how many data points to return, what does it look like from an API perspective, and as PJ said, like, you have situations where you're getting stuff directly kind of from the pharmaceutical company that's coming into your system, or you could be getting that information from the provider, right? And both could be vastly different sets of information. And so we work with both of those groups and then the associated IT teams to say, hey, here's how member ID matches from that system to our system to ensure that the mapping is all complete as well. So that way there is no disruption to workflow and then process there.
Awesome. Thank you both. Any other questions? Feel free to type them in. If not, we can go ahead and jump back in. I will just reshare my screen. Cool. So with that, thanks everyone for joining today, and thank you PJ and Tom for sharing your expertise here. If you have any further questions after today's session, you can contact us at seekerpharma@careviso.com, or you can reach out to PJ directly at pflanagan@careviso.com. If you'd like to book a demo, you can use the above emails, or you can also visit our website at www.careviso.com/contact and fill out a form there.